All right, so this is a talk actually that Ralph Marcuscio put together, and I'm giving it because he is celebrating his birthday and watching the eclipse. That's why he's not here, and I get the opportunity. Well, I think they went to the path of totality. He wanted the details. Okay, so the next two talks are really nicely linked with what Prism just talked about, and thinking about opportunities for to modulate inflammatory response to potentially help fracture healing. So there's no disclosures. I think everybody has seen statistics that just basically emphasize how big global aging, big of a burden global aging is going to become. You can see here in this graph just an exponential increase in patients over 65, that's in blue, and more than quadruple the number of patients in this 85-year-old bracket and older in between 2020, 2000 and 2040. So global aging is going to become a big problem, and we're going to see it especially impact us in thinking about fragility fractures. So here's some more statistics that just kind of drive home how many patients are going to start to having fragility fractures. There's a 33% increase in the global number of new fractures. I like the statistic that every 3 seconds in the US there's a fragility fracture, and over 65, 1 in 3 women and 1 in 5 men will experience a fracture. So one of the problems we know that happens is there's delayed healing observed in elderly patients, and of course, increased morbidity. So what are the opportunities to develop novel therapies and novel treatments to address fracture healing in this population? So I work in the basic science world, and we try to validate new theories by using preclinical models of fracture healing. Mice is a very common model system that's used because you're able to see the impact of inflammation, loading, movement, all of these things, pain behaviors on in a model system where you can actually test new drugs. So this is a picture of a mouse fracture, and you can see that they have let's see if I can point. Okay, there's the fracture right there, and basically we put the mouse leg right in here, drop a weight on it, and induces a fracture that's traumatic to the bone and the muscle, so it's more clinically relevant than some models. And you can see the healing here is going to happen. First, you form a cartilage callus, which is shown here in red. That cartilage calcifies and transforms into bone during healing. So in a mouse, this process happens in about 28 to or 4 weeks. And so you can see the first step here histologically, again, is that you form a cartilage callus, and then that cartilage callus matures and turns into bone. And a 4-week-old mouse heals very quickly. A 6-month-old mouse has less cartilage and less bone. And by 18 months, this process is really quite delayed, and you see a very protracted soft callus formation. So this can be quantified, and here you can again just see that in these elderly mice, which is marked here in red, you have a general shifting to the right, which is emblematic of their delayed fracture healing relative to younger mice. So again, this just shows you that in mice, we can use aging as a process that resembles clinical aging, and then we can now start to look into therapies. And so one of the things that's really interesting, and one of the reasons that these mice have delayed healing, is because they're generally pro-inflammatory. And if you look in their plasma, they have significantly increased IL-6 levels compared to juvenile or normal adult-aged mice. And so this process has actually now been called inflammaging, and it refers to the process of your immune system becoming more pro-inflammatory as you get older. So Ralph's group did an experiment where they created chimeric mice. So basically irradiated a mouse to remove all the bone marrow cells, and then transplanted juvenile or young mouse bone marrow into this old mouse that had been irradiated. And so what was really interesting about this is just by replacing the bone marrow component of old mice with the juvenile bone marrow, you were actually able to rejuvenate healing. So this is showing, This is showing you that actually now the elderly mice, if you just put old mouse into old mouse, they still heal like an old mouse. But if you put juvenile into an old mouse, they start to heal much more closely to a juvenile mouse. And you get increased bone formation and decreased cartilage formation. So what's interesting is that it wasn't because the cells from the bone marrow contributed to the fracture healing process. It was actually just because you replaced the immune system and you reduced the inflammation. So this shows you that it wasn't that you recruited cells, but rather that you reduced the amount of IL-6 and TNF-alpha in the old mouse, and that contributed to a better inflammatory environment, which improved healing in these older mice. So the next part was trying to figure out what cells were responsible for this pro-inflammatory system or pro-inflammatory response in the old mice. And what they specifically found that of the immune system, they started to focus on macrophages and showed that the macrophages were actually coming into the bone, and it was these pro-inflammatory macrophages that secreted the IL-6 and TNF-alpha that contributed to the inflammatory system. So as we start to think about ways to innovate therapeutically options to address this inflammation, Ralph was able to test a novel drug here where it prevents macrophages from being recruited, these pro-inflammatory macrophages from being recruited to the fracture site. And so they gave this Plexicon drug that was developed out of Berkeley, and it inhibits the macrophages from recruiting into the fracture site. And with this drug, just by inhibiting the macrophages, these pro-inflammatory macrophages, you were able to improve the healing in old mice. And so this is pretty exciting, and specifically what you can see is here the young mice are in yellow, and so this is what we call a principal component plot. So it shows you how the mice healing is segregated, and this is all the mice that were treated with the drug. So we have young mice in yellow, old mice in green, and you can see they heal very differently. But as soon as you give the Plexicon drug, which is the gray group, the mice start healing, these old mice start healing more like young mice. What's particularly interesting, though, in this graph is you can actually see 3 old mice, those are the green mice, that cluster with the young mice in yellow. And why that's interesting is it suggests that there's 3 old mice that are sort of super healers. They healed like young people, and this is what we see in the human population as well, as not all of us age at the same rate, and there are some super agers that actually can heal well. So trying to understand what is unique about these 3 mice that are bred, under conditions of they're congenic, they are genetically identical, essentially. Why these theoretically genetically identical mice might heal like young mice is really interesting and an area that we're continuing to explore. So the conclusion of this is that macrophages are a huge contributor to the pro-inflammatory environment that leads to dysregulated or delayed healing as we age. And these macrophages may potentially be able to be directly addressed with a novel drug that blocks their recruitment to the fracture site, so preventing this upregulation of a pro-inflammatory environment in the fracture.